Neil Ferguson of Imperial College. Professor Ferguson, good morning.
Good morning.
What are you reading into the latest data in terms of how quickly this variant is spreading?
So it's now in well over the majority of local authority areas in the country and is now the dominant strain. The majority of new cases are of the variant, and that's obviously concerning. We're still working on trying to assess exactly how much more transmissible it is, but it has gone from being really a small minority a month ago to the majority variant, and that's clearly of concern. On top of that, we know that it partially evades the immunity generated by vaccines. Thankfully, if people have had 2 doses, then there's still a large amount of immunity and protection remaining, but it's not quite as good as it was before. And so in combination, that is of concern. And so I would say kind of step 4 is rather in the balance. The data collected in the next 2 to 3 weeks will be critical.
I was going to say, with step 4 being June the 21st, what's your assessment of current trends? Obviously, we need more information. Obviously, the next 2-3 weeks is where the decision will be made. But on current trends, is your judgment, as that of other epidemiologists increasingly seems to be, that June the 21st should not see a full reopening?
So as I said, it's in the balance. On the positive side, we do have very low infection levels still, despite this new variant. And in latest ONS infection survey suggests less than 1 in 1,000 people in England are infected at the current time. Slightly higher in Scotland, though. And overall case numbers are ticking up now in multiple areas, but particularly in the northwest of England, but still at a relatively low rate. But on top of that, we now have the Indian variant. The key issue as to whether we can go forward is, will the surge caused by the Indian variant, and we do think there will be a surge, be more than has been already planned into the relaxation measures? So it was always expected that relaxation would lead to a surge in infections and to some extent a small third wave of transmission. That's inevitable if you allow contact rates in the population to go up, even despite immunity. It's just we can't cope with that being too large. And that's why I'm saying in the next 2 or 3 weeks, we will be able to come to a firm assessment of whether it's possible to go forward.
OK. I want to ask you about Dominic Cummings' testimony yesterday. You sat in on some of those early crucial SAGE meetings. That's the Scientific Advisory Group for Emergencies, which he mentioned. A critical question that he raised is, at what point did you as SAGE determine that a policy of pursuing herd immunity would lead to a vast number of deaths? When was that?
So the earliest really modelling which actually attached numbers of deaths to the projections we've been doing earlier was really in the first week of March. There was a key meeting that actually we hosted at Imperial with NHS and colleagues from the London School of Hygiene on Sunday the 1st of March, which kind of finalised estimates around health impacts. And so the week after that, really. So,
because Cummings says that as late as March the 11th or 12th last year, the government and its advisors regarded herd immunity as inevitable. He said that that fundamental logic was still operative then. Do you agree with that account? Because the timing's crucial here.
First of all, I should say I wasn't privy to what officials were thinking within government. I was never part of those meetings. So, I would take his and other people's word for what was going on within government. I would say from the scientific side, there was increasing concern that week leading up to the 13th of March about the lack of a clear, let's say, resolved plan of what would happen in the next few days in terms of implementing social distancing.
OK, and what role did you or SAGE play in shifting the policy or the thinking in number 10 from one of pursuing herd immunity to one of engaging with a lockdown?
I think the key issue, and it's multiple factors. Partly the modelling, which had been around for a couple of weeks but became firmer, particularly as we saw data coming in from the UK. And unfortunately, I think one of the biggest lessons to learn in such circumstances is we really need good surveillance within the country at a much earlier point than we actually had it back in March last year. So I think that's, as we saw the data build up and it was matching the modelling, or indeed even worse than the modelling, then that, let's say, focused minds within government.
And just briefly, the most consequential claim he made was that tens of thousands of people died who didn't need to. Do you agree with that?
Well, I've gone on record before to say that had we locked down a week earlier, we would have, I said at the time, saved half the lives, but that really equates to that was much earlier in the pandemic, about 20 to 30,000 lives. And I think that's unarguable. I mean, the epidemic was doubling every 3 to 4 days in the weeks, 13th to 23rd of March. And so had we moved the interventions back a week, we would have curtailed that and saved many lives.
Professor Neil Ferguson, thank you very much indeed.
It's coming up to 7:15.